Hi, I'm Jenny from Alive and Thriving Healthcare, and you may or may not know that we have brought on Dr. Kimberly Milliff, who is a board-certified family medicine physician who specializes in osteopathic manipulation therapy, or OMT. I sat down with her and we talked about it, what it is, who it's for, how you do it, why you would do it. I thought I knew enough because she has done it to me, and I love how I feel afterwards. But you'll see when we sit down, things come up that I had no idea. So you can watch it. Don't judge us on our video quality because that's not our forte. But there's a lot of good information, and I think you will learn something, and I hope that you come and see her because she does amazing work with OMT. All right. So, can you tell everyone what osteopathic manipulation therapy is?
Yes. The way
that was kind of dumb how I said that, huh?
No, not at all.
Do you know what it is?
Yeah. I only spent a few, 1,000 hours learning.
Yeah.
But the way I have always explained it very simply to people is that it's a combination of chiropractic, physical therapy, massage. So like all the cracking and popping that chiropractors do, we can do that. But we also have a lot of gentler techniques to kind of move things around, get them back in alignment, improve pain, range of motion, things like that.
And who typically gets this done?
Anyone can.
Okay.
We, of course, see a lot of neck pain, back pain, sciatica, headaches. We see a lot of that, but really anyone, any age. We do OMT for medical reasons, constipation, sinusitis, migraines. So really anyone and almost anything.
Okay. And is there a reason that someone wouldn't get it?
There are contraindications to certain techniques. So especially the cracking and popping that we do, there are certain medical problems in certain patients that specific technique isn't appropriate for.
Okay.
But there is a way to help almost anyone.
So would you say that would it be fair to say that it's not a one size fits all?
Correct.
Okay.
Every patient is treated a little bit differently depending on what's going on, like underlying dysfunction, what their complaints and concerns are, what their goals of care are. Every treatment is tailored to that specific person.
And how would somebody go about getting to know like what they need or what would work for them, or how would you know?
Come see me.
That works.
So with an initial assessment, I do a pretty deep dive into what brought you to see me. So is it neck pain or headaches or back pain or whatever? And then I do a pretty deep history in terms of day-to-day what you're doing, exercise what you're doing, what does your work look like, even your desk setup at home. And then doing a hands-on diagnostic assessment and then kind of going from there. And so kind of how we help depends on all of those factors and then what someone's goal is.
And how long would a hands-on assessment take?
Our initial assessments take about 75 minutes. Again, everybody's a little bit different. Mm-hmm. There are, of course, simpler cases and sometimes more complex ones. But like I said, I do a pretty deep history as well as a hands-on assessment.
So if you see someone, you have an initial assessment, you go through their health history, you do your hands-on assessment, and then what happens?
And then we begin treatment. And
Okay.
So it depends a little bit on what's going on, but we use our various techniques to kind of help soften up soft tissues, realign things if we can, to try to improve pain, and then base a treatment plan from there in terms of when do we see you back. I always send you home with homework, so exercises to do at home, stretching exercises to do at home, even comfortable positions if you happen to have a flare of pain at home. To kind of, one, help maintain what we're doing here, but two, to also just give you some tools to use in the meantime.
And then how often initially do you see somebody? So if someone will do back pain, like a lower back pain, say it's a lower back type pain, that's pretty common. So you do an initial assessment, and then how many times a week are you seeing somebody?
I usually don't see someone any more frequently than every about 2 weeks.
Okay.
And then kind of spacing it out from there as needed. So problems that have been ongoing for a long time take a lot longer to get to kind of a happy, stable place.
To
Correct.
undo everything.
Exactly.
Yeah.
And so those people we'll see like more frequently in the beginning. And then a lot of times I have patients that come in every 4 to 6 weeks for maintenance after that.
And I think what people have been asking me, and I've learned from you what to say to them, but if someone were to ask, well, why should I do OMT as opposed to seeing a chiropractor? Or going for a massage?
Yeah, I think everyone has a different opinion about what works well for them. Mm-hmm. But in my personal opinion, we get to a root cause a little bit better. And when it comes to cracking and popping, they can help a lot with acute pain, but they don't tend to give you long-term relief.
Okay.
And so when it comes to OMT, our goal is long-term relief. So our goal is to figure out what the problem is, help you now, but also help you maintain that. And so instead of just repeatedly popping things over and over, which doesn't always kind of fix the root cause.
And what if someone came in to see you and you notice they have a knot, like a real big tension, in their, not just me, but if they have like a tension, would you because you do trigger point injections, so would you consider doing that over OMT, like during your assessment? Can you switch it up, or is it if someone comes in to see you because they're doing an OMT assessment, like that's it?
No, they're super complementary services. So trigger points can help OMT work even better. Okay. So a lot of the times the way I utilize trigger point injections is to kind of settle a muscle down and help make OMT more effective. And so we can absolutely do those kind of in the same session.
Okay. And then, so here people have been asking me too, we do IV therapy, we do therapeutic facials, lymphatic drainage, all that. And people have been asking, like, can they do it together? Would you have any problem if someone was doing hydration via IV with doing the same day or at the same time of doing OMT?
Not really. One of my attendings in residency told me that a good osteopath can do OMT anywhere. And so I can work around almost anything. The only before and after hydration is absolutely fine. Having an IV in place if we're needing to utilize your upper extremity for something, we could work around until the IV is done, but there's no contraindications to having multiple services done in one visit.
And would you recommend hydration, IV or otherwise?
Absolutely. So any type of manipulation, chiropractic, osteopathic, any of those things require some energy from your body to kind of heal after. And so we always advise hydrating after. If you've ever gotten a massage, they tell you to hydrate well after. And that's really important. So hydrate can kind of help give your body better healing process.
And is there anything after an OMT session? So if they're coming in for their initial assessment, and they're going to be moved around a bit, or when they schedule follow-ups, is there anything that someone shouldn't do afterwards?
Not necessarily, not as a rule. I give people pretty specific instructions about what to do and not do at home after, depending on what their complaint is. Like, I see a lot of men with hip and low back pain, and it's because they've been sitting on their wallet for 15 years.
Oh.
And so I will give people instructions about that, or if there is something that we have figured out that's triggering their pain or dysfunction, I'll tell you to stop doing that. But really, you can go about normal life.
What about like after a session doing like a workout, or for people who have like the weather in Virginia, it's going to get warm and muggy real soon. Like outdoor work or sitting in a sauna, or
make sure you're maintaining hydration. But if you're someone who's already an active person, you can absolutely continue to go about your normal workout. I don't know that I would like start a new CrossFit routine right after OMT. Sometimes, especially again, if someone has had some of those like really big knots for a long time and things like that, there can be a little bit of soreness after an OMT session. And so you may not want to do something really strenuous. But again, as long as you're doing things safely, there's not a ton of limitations afterwards.
And people have asked, and I've already asked you, but tell everyone else. Do you need to have imaging done? X-rays, CTs, MRIs, do you need to have that done prior to seeing you, or do you order that, or do you even need it?
Sometimes. So yes and no. So imaging can be helpful, and there are certain cases where it's absolutely necessary. It's not an absolute necessity for every single patient. If they've already had it done, I will absolutely review it. And in certain cases, we need to do it to proceed safely if people are having certain concerning symptoms for like nerve entrapments and things like that. We can absolutely order imaging if we need to, but it's not an absolute necessity for every patient.
And if someone is hesitant about getting OMT, what would you say?
Come see me.
I think that's fair.
Because I think a lot of people get nervous, or they've had experiences with chiropractic manipulation in the past. And my type of manipulation, I think I'm a little bit gentler. I'm not going to force a pop if that's not going to help. Not everyone needs to be popped necessarily to get relief. Like I said, there are a lot of gentler techniques we can do to help improve pain, range of motion, and achieve people's goals. And I think communication about like what people's hesitancies are can be super helpful. And so I will always answer any questions, but I'm also very communicative during someone's assessment about what I'm doing, where I'm touching, where we're moving things. And so I think if people are hesitant, I mean, come see me, ask questions. And again, I think I'm fairly gentle in terms of manipulation unless we...
Yeah. And what about teenagers?
Oh, yeah, come on.
Okay. And what about like someone with scoliosis?
Yeah. We can't fix spinal curves necessarily, but with scoliosis comes a lot of other problems.
Okay.
One, assessing scoliosis, we also start assessing like leg length discrepancies and things like that. And so there are things like heel lifts we can talk about. But with scoliosis also comes a lot of pain a lot of the time. Muscle spasms, pain, things like that. And so we can help those things and also talk about exercises and things at home to try to help things not kind of continue to progress and get worse.
If you were to say have a young athlete, teenage, young 20s, high school, college, that age, and they came to see you, would you also be able to relay the information to like their athletic trainer, or at least give them information, or like kind of a comprehensive, collaborative is the word I'm looking for, like a collaborative type of thing? Or are you just like on your own off on the island?
I collaborate as best I can. I have written notes for athletes before. I have, I'm a big fan of kinesiology tape. For certain things. And so like I have taught athletes.
Do you put that on people?
Yeah.
I didn't know that.
Yes. So when I teach people how to tape themselves for certain complaints, and to also like to discuss with their trainers, because various trainers have different levels of comfort when it comes to kinesiology tape, but it's one of my favorite things. For athletes, for pregnant people.
Yeah, that's what I was going to say.
Yes.
Is OMT contraindicated in pregnancy?
No. Is it? No, there are some techniques specifically designed for pregnant patients.
And is that for, and this is, I really don't know this answer, so a prenatal massage, is that similar to OMT for pregnancy or no? Not
really.
Okay.
Yes, there are certain soft tissue techniques we do to kind of help. But there's also kind of more focused assessments on what we know problems are in pregnancy. And so we know like your sacrum and your hips and your pelvis all get a little like out of whack, for lack of a better term, when you're pregnant.
They're working.
Yeah. Like everything is shifting and moving. Your body is releasing hormones that are making all of your ligaments and tendons softer. And so things are kind of shifting around in a way that your body is not used to. And so you end up with a lot of hip, low back pain, booty pain, pain in your legs, swelling, all of those things. We have techniques for all of those.
So when we go back and watch this video, everyone that will see this will see the label go on like in real time.
Yeah. There are lots of, like I said, we can help almost anybody with almost anything.
That's pretty cool.
Mm-hmm.
Yeah. But a lot of people don't know about it.
No, which is sad. But it's also just because it's not a super available service. And so despite the fact that about half of graduating physicians at this point are DOs, incorporating OMT into a medical practice is challenging. And so with the way healthcare is built in our country, it's not something that's easily incorporated into a busy practice, no matter what it is. And so whether it's primary care, I know a couple of primary care doctors that still offer OMT.
Yeah.
And a couple of sports med physicians that offer OMT. But it's not usually a super advertised service. And it's not something that they're kind of seeing patients outside their practice for. And so it's something that if you happen to get in with one of those providers, it's a service that they offer. But people aren't seeking it because they don't know what it is.
Right. I didn't know before I knew you.
Well, and then once people know what it is, they don't want to live without it. But also then trying to find a provider that does OMT can be very challenging.
Yeah, I imagine. What's the challenge in practice? Is it an insurance issue? Is it a reimbursement issue?
It's more of a time.
Okay.
It's more of a time issue. Insurance will reimburse for OMT at a certain level. The benefit that a patient receives for OMT is not comparable to like what you're reimbursed in terms of cost. And so your insurance company would much rather you see 3 of your diabetic patients in that time than do a 70-minute OMT appointment.
Okay.
And so in a busy, especially like primary care practice where you've got a panel of 2,500 to 3,000 patients that you're trying to see all the time, blocking out an hour for one patient for OMT is almost impossible. Especially when you could see 4 patients in that time and actually get reimbursed more. And especially in primary care when reimbursement rates are continuing to go down and you have to pay your MA and your front desk and keep the lights on and all of those things.
Yeah.
I think a lot of people, end up doing what's necessary to care for people's chronic medical problems and kind of leaning away from hands-on manipulation because it's mostly time, but it's time and reimbursement and availability. And then if someone's residency program didn't provide them on really good OMT education, it's kind of just like if you don't start IVs all the time,
right?
You kind of start losing comfort in doing that. Yeah. And I think that happens with a lot of DOs too, is that when they go to residency, if they don't have really passionate osteopathic providers that are showing them how to do a quick and dirty OMT to solve some problems at least really quickly and focusing on how beneficial it can be, you kind of lose it a little bit.
And how long have you been doing it?
Oh, a long time.
I know.
Don't tell them I'm old. I finished medical school in 2017.
Okay. Holy cannoli, it's almost 10 years.
I know.
Okay.
So I finished med school in 2017. We obviously learned OMT in med school. It was part of every single block of learning that we did. I luckily got to do a lot of OMT even in my clinical rotations my 3rd and 4th year because the providers I worked with were wonderful. And then I finished residency in 2020, and I did a lot of OMT throughout my residency. We had an OMT clinic at my residency program. So I did a ton of OMT then, and then as an attending, I've continued.
So a few patients.
Yeah. One or two.
Seen a thing or two.
That's when people are like, how can you feel that? I've touched a lot of people.
Yeah.
Which sounds a little creepy, but is also just true.
Yeah. Oh, what would be like, what should someone wear to an OMT appointment?
Not a skirt if you can avoid it.
Okay. And I mean, you've done it on me, and I've had on usually stretchy scrubs but leggings would probably be good.
Leggings would be fabulous. Like most types of athletic wear are fine. Like I said, I can work around just about anything, but we are moving your body around. So something semi-flexible, but like a lot of people have come in and around work. And so like,
if that's
we
what
do
you're
what we
wearing,
got to do.
Yeah.
And even we'll try to maintain privacy as best we can.
Yeah.
I tell women if you have to wear a skirt for like religious purposes, personal preference, whatever, just maybe putting leggings or something on underneath. So if we're moving legs around, we can just kind of maintain modesty. But there are...
And it is done in, I don't know about other places, but here it is done in a private room.
Yes.
So, I mean, there's other places, you know, if you're doing like, what do you call them, quick and dirties?
Yes.
You know, if you're doing like a clinic or like a demonstration, like of course, you know, it might be like out in the open.
Yes.
Yeah, but here it's in a private room.
Yeah. And so we can work around just about anything, but the easiest thing is something flexible, athletic wear, leggings, something stretchy, something you just feel comfortable moving in.
That works. I think I asked you everything I had. What else do you think I should ask you? Blooper reel is going to be fire.
Some of my favorite OMT techniques.
Oh yeah. Yeah. What are some of your favorite? That's a good one. Hey, what are some of your favorite OMT techniques?
Ischemic inhibition is one of my favorite, aka a trap squeeze.
Oh yeah, that's my favorite too.
Yes, that's a good one. A sinusitis treatment is one of my favorite ones.
Oh.
Because it helps pretty quickly. It's one, my sister loves it. She gets sinus infection so bad her face swells.
Yeah.
And so kind of help moving everything around, open things up a little bit, can give you a ton of relief. A very popular one in our residency program was a mesenteric release to help with constipation. Again, it's like less than a 5-minute treatment that can help, especially like your tiny humans at home. That's always a good one. But really anyone, that's always a good one. So
piggybacking on that, the way we have it set up, and this is part of my not knowing, we have it set up for an initial 75-minute appointment and then follow-up appointments with your plan that are either 60 minutes or 45 minutes. And then we have the 30-minute acute problem. So, and I have it written that it's for those people who have something pop up after they've had their initial assessment. But if someone was having like a sinusitis, do they need to do the 75 minutes?
Not necessarily.
Or could they just be like, hey, I have a sinus infection, or I have a lot of congestion, or allergies are killing me. It would be for allergies too, I would assume.
Yeah.
They could do a 30-minute appointment.
Yeah.
Oh, okay. I didn't know.
Yeah.
Well, guys, I'll fix that.
Those can be fine as long as they know, because you know, a quick appointment, we can't get into the nitty-gritty of like super long-term problems, but absolutely for like sinusitis, constipation.
Okay. I didn't realize that.
Yeah.
Okay. So that would just be, so that's the difference between going to an urgent care for one thing that's just happening right now versus your primary care where you go for your chronic issues.
Exactly.
Oh.
Yeah.
Well, I'm glad we're doing this so I can learn things. I got to change the website a little bit.
Well, then we could always, if something comes up during that 30-minute acute visit, we can always say like, hey, this seems like it's going to need kind of a deeper dive.
Yeah.
Like.
Right.
if you want to really like get to the
Right.
bottom of it, I would recommend scheduling.
Right. Like if you're coming in
assessment.
for the sinusitis, if you're
Mhm.
coming in for the congestion and you start saying like my lower back hurts, like
Yes.
doesn't fit there.
Yes.
That's a longer.
Yeah. And so we may have to redirect if we find certain things. Because other things, some people will say, I didn't know that hurt till you touched it. Or as we're doing OMT, they'll start asking questions. Oh, would
Yeah.
this help with my
Yeah.
hip pain?
Yeah.
And we say, yeah, absolutely. Come in for a full assessment.
Okay.
And so,
yeah. And even this is how I thought the acute appointment was. But so people who have a plan, they've done their initial assessment and they have a plan. They see you every 2, 3, 4 weeks. But in between that time, if something comes up, they pull something, they do something. They went to Busch Gardens and rode the roller coasters, and something flares up. That's what that 30-minute appointment can also be for.
Absolutely.
Yeah.
Yeah.
Cool.
Or like, hey, I feel like my rib is out of place, or hey, I'm having like, I woke up with a crick in my neck.
Yeah.
And we just like,
that's never happened.
Yes, absolutely.
And then I'm learning, and now I have all the questions. Do you prescribe medication?
If we need to.
Okay.
And so, again, it depends on what's going on. I have historically worked with a lot of patients, orthopedic providers, primary care providers, pain management providers about like things that might be helpful or things that I'm finding in terms of that might be helpful pain-wise, or things that I have prescribed that might help, whether it's a steroid taper or, if we're doing something and I feel like certain medications might be helpful that maybe I don't want to manage long-term, I'm happy like sending a message to their primary care to say, hey, this is what we're doing.
Okay. Yeah.
This is what I've diagnosed. Like these things might be helpful.
Yeah. That's cool. Glad I'm learning.